Hello, my name is Darnell and I'm presenting my senior year culminating project. My research question is, what effects of childhood trauma can be observed on developing a mature adult? I first began with looking into what statistics were available about how common trauma was. The phrase adverse childhood experiences is used across many studies. So what does that mean? Adverse childhood experiences, or ACE for short, refers broadly to any abuse, neglect, or household dysfunction that particularly a child may have experienced. That can range from parental substance use, sexual assault, or emotional abuse. While circumstances vary from the individual, what they all share is that it can lead to significant long-term consequences for the child. About 60% of American adults have experienced at least one ACE. When looking at the graph, that percentage further represents those who may have experienced one or more. Often, these traumatic experiences can overlap. From data gathered by the Compassion Prison Project, which is a nonprofit organization, 97% of the prison population has had at least one ACE. The graph overwhelmingly presents that a majority had experienced four or more. Found that age, gender, mental disorders, and treatments were factors that I could specifically analyze to identify trends or similarities from childhood to adulthood. Additionally, were there disparities between what males and females experienced from their ACE? And finally, what mental health struggles may people experience from these events, and how is that treatable? The brain begins to develop around the 5th week of pregnancy. Different regions of the brain function for varying purposes. The brainstem controls automatic responses. The limbic region includes the amygdala and the hippocampus. The amygdala is responsible for the fear response, and the hippocampus has a major role in memory and learning. During the final month before a baby is born, the amygdala can register fear, which develops a sense of fear before being able to speak. Ms. Kuhn, who is a licensed clinical social worker in Virginia and Maryland, commented on some of the effects that trauma may have on the brain during our interview.
Early childhood trauma has actually been associated with reduced size of the brain cortex. So this area of the brain is responsible for functions such as memory, attention, perceptual awareness, thinking, language, and consciousness. So this is a huge deal if early childhood trauma actually changes the brain. And these changes could affect IQ, the ability to regulate emotion, and the child may in general become more fearful and not feel as safe or protected. So the big takeaway, trauma changes the brain. And the younger we are, the harder it is to make sense of that trauma. And so the effects of it can be more profound.
Trauma sensitizes the amygdala to the perception of a threat, which then can be triggered over time by smaller amounts of stress. As a result, higher levels of cortisol will be produced, which then prevents the hippocampus from functioning properly. Higher levels of trauma can increase bodily production of proteins like S100B, which is potentially damaging. That can leave someone more susceptible to inflammation, which can be seen through elevated stress hormones. This can lead to a racing heart and cold sweat. When looking at school-aged children who may have experienced trauma, some symptoms include that they may have some difficulties in learning, socializing, and misbehavior. Ms. Gilbert, who is a psychiatrist at Stafford High School, elaborated on what symptoms students may present.
So in the school environment, we could see different reactions to trauma. So you've probably heard of the fight, flight, freeze. So sometimes we see that within the school environment. We see kids who might be withdrawn, very withdrawn, or we might see kids who are acting out. We also see how trauma can, or traumatic experiences can influence students, their relationships with others, how they respond to others, how they interact with others and connect with others, as well as their ability to concentrate, to pay attention, to complete their work, their behavior at school, and really their overall functioning at school.
Schools provide essential services for students all throughout development. The combined effort of teachers and staff can help combat the potential harm of trauma through early intervention. Ms. Clement, who is also a psychiatrist at Stafford High School, elaborated during our interview on how the American Psychiatric Association trained Stafford County mental health staff procedures who could then further that teaching to students.
We teach staff what to notice about students. So, we always say, like, the first couple of weeks we're getting our baseline for kids. What do they typically present as? And then we can tell if at any point they deviate from that baseline, right? So say you have a kid who's really interactive in class and engaged, and then one day he has his head down, and then the next day he has his head down. That would be a deviation from his norm. So that's the notice. The next part is we teach them how to talk and what to talk about. So based on what the student gives back. So we give a few different scenarios and how they can respond, really building their skills of handling whatever comes their way, right? Because there are things that are meant for mental health staff to manage, and then there's things that our teachers can manage.
Yeah.
So really giving them those tools. And then the last piece is that ACT piece. So then once they learn what they need to learn from the student in the talking phase, they then know how to respond. And that can be referring the student or linking the student with the counselor, linking them to meet a social worker, just having a follow-up with the student, or saying, hey, I'm here for you.
All throughout life, people will experience hardships and difficult emotions. When researching the tools people have used to tolerate past experiences like trauma, coping mechanisms have provided a pivotal role. Ms. Kuhn elaborates on factors that go into coping mechanisms.
Coping mechanisms are skills that people can use to reduce their emotional distress. Everybody's unique, so what works for one person may not work for another. It's important to tap into what already helps you. So a lot of times when people come to see me, their normal ways of coping maybe aren't working anymore, or they haven't had time to tap into what works for them because they're just so overwhelmed with whatever situation is going on. So when I come up with a coping skills list with my clients, the first question I already ask is, what do you already do that helps you? So we kind of tap into that, and then I might throw out some other suggestions too that has worked for other clients or that research shows can be helpful.
When looking later in life to the Middle Ages, a report conducted by the Department of Psychology at Arizona State University found that people who had experienced trauma had poorer health in their middle ages. The data collected analyzes the socio-emotional regulation of people, and through self-report questionnaires in a 30-day journal, identified that participants who wrote into their book were more likely to write about negative events in the day rather than positive ones, and that they are more sensitive reaction-wise to events throughout the day. A link has been found in what is commonly known as trauma mastery. Trauma mastery is where an individual learns to cope with those negative events, but is associated with higher stress levels. In an observational study conducted for women between the ages of 18 and 65, a relationship was found that the extremity and initial start time of an abusive substance was linked to be earlier and more extreme for those who had experienced more trauma at a younger age. An explanation for this trend is that, especially at a younger age, people may not have coping mechanisms or not effective ones, which can lead to drug usage through opportunity and seeking an escape. In an observational study conducted for women between the ages of 18 and 65, a relationship was found that the extremity and initial start time of an abusive substance was linked to be earlier and more extreme for those who had experienced more trauma at a younger age. An explanation for this trend is that, especially at a younger age, people may not have coping mechanisms or not effective ones, which then can lead to drug usage through opportunity and seeking an escape. Mental health disorders vary on a large spectrum and are categorized by specialists. They affect the way we think, feel, and behave. While not everyone who has experienced trauma will have a mental disorder, those who have are at an increased risk for developing one in their lifetime. Depression distorts your perception of reality and leaves someone feeling emotionally unmotivated. It can leave them feeling unworthy and can lead to unhealthy relationships with others and themselves. Some other characteristics include becoming distant to others, straining relationships, and can be overall debilitating. When someone has anxiety, they typically experience excess amounts of stress. that can accumulate to physical characteristics like sweating, a racing heart, and panic attacks. That leads to degrees of discomfort for an individual and potentially avoidance of the stressor when seeking to not experience that emotion. People who have experienced verbal, emotional, or any other harm can experience a form of PTSD. Effects can be experienced where people relive those moments, high levels of anxiety, and emotional numbness, to mention a few. While not everyone who experiences trauma will develop PTSD, it can be developed at any age. It can result in night terrors and panic attacks. Triggers can come from anywhere and anything, like fireworks. When not under control, people who have experienced PTSD may become limited in what activities they do, severely affecting their lifestyle. While the most effective way to reduce trauma and the effects of it is to help avoid them in the first case, that is not always possible. There are a variety of modalities for treatment depending on the needs of the individual. My research focused on psychotherapy. Sociotherapy refers to treatments through talking with a psychiatrist or other mental health provider. Selective serotonin reuptake inhibitor medications like paroxetine, fluoxetine, and sertraline, which are known as antidepressants, have also been used to treat mental illnesses. How the medicine works is to increase the levels of serotonin in the brain. That can lead to calming effects. Sociodynamic therapy can be combined with medications to support clients. Exposure therapy is commonly used to treat obsessive-compulsive disorder, or its acronym OCD, also PTSD, and other phobias like a fear of spiders. This would be done through cognitive decisions where the person is directly aware. The goal is to identify the trigger and then address it in a safe, controlled environment. Treatments usually vary in two ways. One is flooding, where they receive an overwhelming amount of the issue, or the other is desensitization, where the quantities are slowly increased. This is done so the individual can gain more control over triggers and then implement that into their daily lives. Psychodynamic psychotherapy is the treatment that we most commonly associate with therapy. It typically involves direct conversations between client and clinician. During that process, the clinician can analyze unconscious patterns, which then can be identified. From there, a plan can be developed which can help the client develop the tools to be able to deal with those problems on their own. It has been documented to be effective in treating depression, borderline personality disorder, and anxiety. Cognitive behavioral therapy, which has been effective in treating mood disorders, eating disorders, and anxiety, is a treatment that Ms. Kuhn utilizes at her practice.
So cognitive behavioral therapy is the main type of therapy that I do, and it's a type of therapy that's based upon the principle that emotional distress is based on how we think, feel, and behave. So if we can change how we think about a situation, our emotions and our behaviors about that situation will also change. CBT, as it's known for short, involves looking at what are called cognitive distortions. So that's basically a fancy phrase for thinking errors, and how cognitive distortions might be affecting our perception of a situation and moving towards things that make us uncomfortable rather than moving away from them. So let me give you an example of a cognitive distortion. So one cognitive distortion might be what's called all or nothing thinking. So that's you're either all in or not. So if I see kids who are like, let's say they get into a fight with a friend and they're like, oh, they hate me, like this is over, the friendship's over. That's all or nothing thinking because there's no gray area. So I would try to help my clients see like, all right, let's break this down. Let's see if there's a middle ground here, because you've been friends with this person for 10 years. Like it's not likely that they hate you. Maybe they're upset with you, but they're still willing to continue with the friendship. So that's an example of a cognitive distortion that maybe I would work with on my with my clients.
Emotional freedom technique, known short as EFT, typically involves 4 to 10 sessions. The client is taught to tap rhythms across their hand, face, head, or collarbones. While thinking about the trigger, the tapping rhythm has been documented to decrease stimulation of the amygdala, which is responsible for the fear response, causing the client to relax. This treatment has been effective in reducing PTSD symptoms and potentially also reducing the amount of cortisol in the body. Eye movement desensitization and reprocessing, or EMDR, is a type of treatment that does not focus on conversation. There are 8 phases. After the client has their history and past treatments recorded, they are then to identify images, feelings, or sensations that cause them distress. During that process, they are told to move their eyes by following a finger or through taps or other bilateral stimulation, which then allows them to experience the treatment. That method has presented evidence of the client experiencing new thoughts or feelings, which has been effective in treating PTSD. The remaining steps include keeping a journal, scans, and reevaluation. Studies have shown that 84 to 90% of single trauma victims no longer had PTSD after 3 90-minute treatments. While still a semi-new treatment option, EMDR has promising evidence indicating it can be one of the most effective options in treating PTSD.